All right. A lot of people think Medicaid in their state is how Medicaid works nationally. Unfortunately, that's not the case. Medicaid is a federal state kind of partnership. The federal government kind of runs kind of the outlines, but the states can make a lot of difference in terms of your Medicaid. So if you are receiving Medicaid, you have a family member receiving Medicaid, a neighbor receiving Medicaid, there's going to be a lot of changes, and it might be coming sooner than you think. Why is that? Well, the big beautiful bill. All right, so the big beautiful bill, it focused on, the political part of it. Oh, we're just going to kick off those 26-year-old people playing video games, in their parents' basement. Okay, fine. All right. Then why did they also cut about $100 billion a year off of it? So if you look at any estimates out there, you're looking at about those targeted individual, those lazy game players, that they stereotyped, which they're not, but anyway, um, it only makes up 4 or 5%. I and a lot of other people say it's actually less because those people are relatively healthy and they don't use that much. But let's use about 4 or 5% of the population. So, and then they go above and beyond that, and they cut about $100 billion a year off of Medicaid to the states, and the states are short $100 billion. But they only got about 5 or 6% of those lazy gamers that they can cut off. So where are the other 95%, the other $95 billion of cuts going to come to? Well, guess what? I don't think I need to answer that question because you already know what the answer is. It's everybody else that's going to receive Medicaid. And again, states do things differently. So I'm going to go through the top 10 list of the worst case scenario that's actually happening right now. It's been happening for years. So if you're in your particular state and your Medicaid is okay, it's okay. That's not necessarily the case in other places. I've already got some people that joined in here in our live chat. So if you got any questions, any particular nightmare stories about your Medicaid, we're putting together a program as well to help as many people as possible make sure they don't get kicked off Medicaid, and we'll talk about that here in a little bit. Okay, so here's how your Medicaid in your particular state can get worse. If you're in one of these 1 or 2 states that are already the worst, then it can actually get worse than it already is, even though it's already terrible, terrible. All right, so Medicaid, states have a lot of flexibility on what they can do. One of the things they do, some states have a very, very, very tight income limit. Medicaid is a welfare-based program, a needs-based program, low income, low resources, 65 and older, a parent taking care of a child, children's benefits, Medicaid for disabled people, and all the rest of it. But it is a welfare-based benefit, needs-based. So the number one thing is income limit. So if you're making a lot of money, you just can't get Medicaid. But what does a lot of money mean? Well, in places like Alabama, a lot of money is $988 a month. If you make $988 a month from Social Security or any other place, you ain't getting Medicaid. Texas, $1,043 is the limit. So if you're making $1,044, you ain't getting it. So there's some states like California that's about 1,800 or so. Other states, 12, 13, 14, 1,500. And what's going to happen is when these states stop getting that money, they're going to have to start kicking people off. And okay, they're going to kick those, the lazy 26-year-old gamers in the basement. They're going to kick those off. And okay, that's going to save 4 or 5%. Then going to come for the rest of us, the other 95%, because they just ain't got the money. So we're possibly going to be seeing states across the country that are going to start cutting income limits. You thought you were good at 1,500. Well, now the new limit is 1,400, so you just might get kicked off. So we need to make sure we join together, and my communities and us, we're putting a program together to kind of be politically active in that regard. So make sure you subscribe if you're new to my channel and all that. Okay, number 2, asset caps. As I said, Medicaid is a welfare-based program, low income, low resources. So resources, some states, Connecticut, $1,600. So if you have any types of savings over $1,600, you're not getting Medicaid. Georgia allows about $2,000, and some states allow, like if you have like a burial insurance or something like that, a whole life that's worth this, or you have a car that's worth over $9,000, even if it's your primary car, they might not. It's just amazing how states engineer their programs to say, okay, yes, we have Medicaid in our states and yada, yada, yada. It's so great. We're taking care of our disabled and our elderly. We have Medicaid, but they make the threshold so low that almost nobody, is able to get it. Okay. And then we have what's called Medicaid spend down. So Medicaid, so some states also, they said, okay, hey, you've got income, let's say in our state, it's $1,000. You're allowed $1,000 in our state of income, and you're still able to get Medicaid with $1,000. Okay, so, but then they say, okay, but you're getting $1,400. But they say, okay, if our limit is 1,000, you're receiving 1,400. You can, if that extra $400 is spent on health, your health care, like prescriptions or going to the doctors or some other type of health related items, then we can subtract that and say you're only making $1,000 a month. So some states do that, but here's the trick. Some states, you have to prove that on a quarterly basis or every 6 months or something like that. But some states, you have to do it on a monthly basis, and that's how they kind of trip you up, is that you have to provide proof every single month that you spent that $400. And sometimes people, don't get the paperwork, or as we'll see, is offices are so understaffed that they don't process the paperwork on time, and people lose Medicaid, not because they're not entitled, not because they're not eligible, not because they're not sick or poor, is because the local local Medicaid office just doesn't process the paperwork timely, and you essentially pay for it. Okay, so, and then obviously that, the long waits just to get in. Tennessee, for instance, eligible, even if you're eligible, 3 to 6 months for them to process your applications. So coverage delayed is coverage denied in a lot of circumstances. So there's going to be a lot of delays going on just to get in. And if you're already in, the renewal process, delays in the renewal process, and problems getting renewed. Utah, a couple of years ago, they had 94% disenrollments. So 94% of the people on Medicaid in Utah a few years ago, 2023, 94% of those people got kicked off of Medicaid. Not because they were not eligible, but procedural, bureaucratic reasons. Utah, they have a terrible system for recertifying for Medicaid, and a lot of people were being kicked off. They didn't receive the letters. They weren't notified. They didn't. They send in the forms, and nothing happened. The whole system was too complicated. People gave up. So that's one of it's called bureaucratic disenrollment. So that's one thing we're going to see a lot of. Going forward, is states are going to say, okay, according to the letter of the law, we have to do X, Y, and Z, but we don't have money. So how do we kick people off without actually kicking people off? Well, we bureaucratic disenrollment. So we make it as difficult as possible. That's why anytime with anything, if you're denied from the Social Security Administration for disability, for retirement benefits, for Medicare, for Medicaid, from food stamp, I don't care what you're denied for, appeal, appeal, appeal. And if you go onto my website, I've got all the processes for appealing that. It tells you exactly how to do it, all the paperwork you need, when
for
you
our
can do it.
nation's elderly and
I got,
disabled.
my video yesterday.
Before
So
Social Security was signed into
let me
law,
get rid of this one.
half of seniors in America
Okay.
I
live
have
in
been a part
poverty.
of Medicare since
Today,
2020.
Okay. We have, okay, Bernie. That was my video yesterday. I apologize. I was trying to pull up my website here. Okay, Bernie. All right. Okay, there. Okay, so there it is right there, mygovexpert.com. This is a live Q&A, isn't it? This is live, right? Yeah, it's live. So you click on the appeals there, and it goes through the entire process of requesting a Social Security appeal, Medicaid appeal, Medicare appeal, Medicare Advantage appeal, all the rest of it. So make sure you check that out. And always, always, always fight it. And we're going to give you some tools to also make sure over the next few weeks, we're coming up some tools to help you fight that, to make sure you get you or your family or whoever. Okay. All right. So complex renewal, loss coverage. Another thing they say, okay, hey, you can go ahead and get Medicaid. We'll get you signed up, we'll get you renewed and all that kind of stuff. You have Medicaid, you got the card, it's a beautiful thing. But where can you go to get your Medicaid? A lot of people already know that with Medicaid, doctors are extremely difficult to find. Hospitals are extremely difficult to find and use Medicaid. It's going to get a lot worse. Some states, they pay a pittance, a very, very small amount to doctors and hospitals and clinics to take Medicaid, 60 to 70%. I think Alabama is about 60 to 70% of what Medicare pays. So doctors say, we just don't want to take Medicaid anymore. And the states are going to be pressured to, because they don't have any more money coming in, they're going to be pressured to cut networks. So fewer doctors, fewer hospitals. And even if you have Medicaid, even if you're renewed for Medicaid, it might be very, very difficult to find a doctor, a hospital, a clinic to help you out. And the ones that take Medicaid, the good doctors, the good hospitals, I'm not saying the people that take Medicaid are not necessarily good, but those doctors and hospitals that can be choosy, they would rather take private insurance, because they get billed quickly and better, and and they say, well, we just Medicaid, we're just losing every time we see one of those patients, so let's just go ahead and So that's another issue. Okay. And then there's also missing core benefits. There's places throughout the country like Missouri doesn't have any adult dental care for people on Medicaid unless it's an emergency type situation. Mississippi, no vision care. Kansas, Nebraska, no transportation if you have medical appointments. Another issue is those Medicare Advantage plans that people have. Dari just came up with a question, a live question, says, my Medicaid has already been drastically changed to a plan with monthly deductible of $788. It's also going to cause me to lose my dual. Yeah, if your Medicaid was changed and you've lost Medicaid, or what a lot of people don't realize is Medicaid, there's certain levels of Medicaid. So if you've been downgraded from QMB, Slim B, or QI, which is the ones that pay for the Part B premium, if you've been downgraded, then yes, you have lost your DSNP, your dual special needs plan. So you need to find a new regular Medicare Advantage plan, and you can reach out to Chapter. They're the ones that sponsor our live Q&A, so you can reach out to them and they can see if they can find you help you get your Medicaid back. If not, then at the very least, they can help you find another Medicare plan. So definitely reach out to them. Their help is 100% free, and they have been awesome to people in our community. So missing core benefits and those grocery cards too. If you're, I see possibly, you got that money crunch, those Medicare Advantage plans might not be able to provide those grocery cards that you see advertised all the time, $200 or $300 a month for groceries and stuff like that. Those do exist. But in some places, they're, just a few bucks, and other places are $200 or $300. So if the money stops coming down to Medicaid, which it is, and another thing about this is a lot of these states are doing a preemptive strike. You say, hey, none of this stuff is going to happen for a couple of years after the the midterm elections, which is interesting. Politicians, well, it's not interesting. We know why. If these programs, if these cuts and everything were so good, why don't they say, okay, these are great. These are great cuts. We need to kick these people off and do this and, cut the budget and save the deficit. Well, the money doesn't go to the deficit. It goes to the super wealthy and the corporations. But anyway, If these policies that they're instituting are so awesome and so great and everybody loves them so much, why didn't they say, okay, stroke of a pen starts tomorrow? No, they didn't do that, did they? They said stroke of a pen, delay till after the election. Yeah, so maybe they were yeah, so they knew that people are not going to be happy about them. Okay, so but the states, even though federally all of these changes and stuff are not going to happen until after the midterm elections for political reasons, allegedly, states have to balance their budget. In almost all state constitutions, they have to balance their budget, and they do their budgets like a year or 2 years ahead. They don't do like the federal government where they do their budget, they're delayed for a month or 2 months to do their budget. They have to balance their budget ahead of the game. So a lot of states are already seeing kind of the writing on the wall. They're saying, hey, next year after there, we're going to start getting less money. So we need to start cutting some of this stuff now. And we already see some people throughout the country that's starting to feel this. All right. So another thing is the Medicare Savings Program. And this is kind of crazy because this doesn't cost the states anything. The Medicare Savings Program is the program that it's funded by general tax dollars. It's not funded by Medicare. It's not funded by the Social Security Act. It's not funded by Medicaid necessarily. Well, Medicaid is funded by general tax dollars, but Medicare Savings Program is also general tax dollars. And it doesn't cost the states anything, but I think they're going to start having problems with that. The Medicare Savings Program is that program that millions of people receive that pay for their Part B premium, that $185. And if you lose that, then you just get a cut in your Social Security check of $185. So a lot of people, unfortunately, are going to lose that because the states, even though it doesn't cost them money, they're going to be cutting the budgets of Medicaid offices throughout the country. And those are the people that process and get you into that Medicare Savings Program. So a lot of people, I think Texas, they kicked hundreds of people off of that Medicare Savings Program because they just messed up. So it's going to happen, unfortunately. And I know when I worked at Social Security, because before I worked at Social Security, I worked for the Department of Social Services doing Medicaid. The entire system, it's called welfare accretion, a buy-in. The entire system is a nightmare to get signed up. You people that have done it know you're like a ping pong. You go to Social Security and Social Security says, well, as soon as Medicaid starts paying for it, then we will, notify Medicare. And then you go to Medicaid and they say, well, we already paid for it. You need to contact Social Security. And it takes months to get back and forth. The previous president signed an act that said, hey, we're going to make this a lot easier so people don't have to play ping pong and make it easier for them. And civil servants, Social Security employees, and Medicaid employees, and all those people are going to do their job and help you. The big, beautiful bill decided, no, not so much. They delayed that extra help. They delayed that assistance. They delayed that the people helping you, making your life easier for 10 years because don't want to make your life easier, I guess. So a lot of people, we need to make sure people don't lose that Medicare Savings Program. So make sure you share and like and keep in the loop. We're coming out with a brand new program to help y'all make sure you keep all that. Okay, number 9 is nursing care. This one, we've already seen this one. Nursing homes throughout the country are already having a very, very tough time. And we see nursing homes already decide that, okay, hey, we're barely keeping, our doors open and our staff paid right now with how much Medicaid, the paltry amount Medicaid pays. And if they're going to cut it another 5, 10, 15, 20% or something like that, we just can't do it anymore. So we've already seen nursing homes throughout the country say, yeah, you got to leave. We're losing money. In West Virginia and Mississippi, Medicaid pays nursing homes far below the true cost of care, up to $1,200 for a short-term resident per month. And $1,200 per month is, it just doesn't cover all the, the building and the staff and all the rest of this. And people don't understand that when you're in a nursing home, when you go to a nursing home, Medicare doesn't cover that. And people say, no, when my uncle was in a nursing home and he still had Medicare and Medicare Advantage. Yeah, they do. You still have Medicare in a nursing home, but Medicare Advantage, Medicare supplement plans don't cover the nursing home. If you're in a nursing home and you fall or something like that and have to go to the hospital, yeah, it covers the hospital, it covers the surgery, the knee replacement, yada, yada, yada. But then when you return to the nursing home, you're on your own. So that's where Medicaid comes in for those people that can't afford that, is Medicaid pays for the actual nursing home. So unfortunately, that's another thing that is going to start being cut because of just everybody not having the money to pay for that. So there's going to be, unfortunately, a lot of elderly people that are essentially are going to be looking for places to stay. And if they don't have family, then yeah, we have to have a national conversation of what's going to happen here. And then above everything else, the prior authorizations. This is the way that insurance companies try to save money. So this the CEO can go buy their new yacht, is deny care, delay care, prior authorizations. So Medicaid already has a lot of prior authorizations to kind of gatekeep money going out, and we're going to see that probably multiply by then by quite a bit more. Okay, so that is the list of things that are already happening and are going to continue to happen. So these are not some theoretical, oh, this is what could happen. No, these are actual things that are happening right now in individual states. It might not be happening in your state, but ask yourself, in your particular state, if your politicians in your particular state all of a sudden get billions of dollars less for Medicaid, what do you think they're going to cut first? Which one of those 10 items do you think they're going to go for first, or more of them, or all of them, depending on your particular state? So we definitely need to get together and make sure this doesn't happen and protect those people that are vulnerable, the disabled, the elderly, children that are receiving Medicaid and all the rest of it. So, okay, let's get into some questions about all things Social Security and everything. Paul, it is my understanding that SSDI has its own funding. Is it also in danger of running low on resources by 2034? Yes, Social Security Disability Insurance, there's a disability trust fund, and that is a separate trust fund. And the disability trust fund is actually good for a long, long, long time. That's why you see different numbers. I always put up the fact that in 90 checks, your benefit's going to be cut by 23%. And you look at other things that, oh no, it's 17%, it's 20%. That's because there's two different trust funds. There's the Old Age Survivors and OASI Trust Fund, the Retirement Survivors and Spouse Trust Fund. And then there's the Disability Trust Fund. So if you put those together, it changes it. If you keep them separately, it changes it. So, but the Disability Trust Fund is actually good for quite a while. It's the other one. It's the Retirement Trust Fund, the Survivor Benefits Trust Fund. It's the Spouse Benefits Trust Fund. That's the one that's going to be hurt. But what they're probably going to do, we don't know. They might just consolidate those to add to put a little Band-Aid on it to keep it hopping for a few more months. So. Okay. Someone's having a little conversation. Does anyone know when you file taxes on Social Security only? Don't you only count half your Social Security? Yes. So for Social Security, whether you're going to tax on Social, I don't do taxes, but you only count 50% of Social Security. I never work for the IRS. So I try to avoid giving information on taxes, but I think I have a little slide there that explains that. But it's basically, 50%, they count 50% of your Social Security benefits when they do the calculations for how much you pay. And then on my website, I've got a link to, let me go ahead and pull it up here. If you go into my website, mygovexpert.com, click on retirement, and let me get rid of this here, and then click on taxation. And it tells you all the details there, how it's calculated. And you can actually go into I've got a link to the IRS website there that you can click on there. And it tells you, it asks you a few questions, and it'll tell you whether you are even taxed on your Social Security benefits. There was an earlier question before we started today. Someone mentioned the terrible fact that their wife was just diagnosed with cancer. So sorry to hear that. And whether she should file for disability or Social Security. Well, they're the same, but I would do both. It depends on the stage of cancer and everything. If she has the worst stages of cancer, unfortunately, then tell the Social Security employee, and that's called a Terry case. And I've taken tens of thousands of those. And if it's a true Terry case, then she will be approved for disability within a few days. Okay. Those, I've had cases of Terry cases. It's a terminal illness case. And I've taken some of those in the morning at 9 o'clock, 10 o'clock in the morning. And then before I leave the end of the day, it's already approved. Or I come in the office the next day, it's already approved. So, but you have to make sure you inform the Social Security employee. Okay. If for anybody, you can apply for both. It's called a rib dib. So, or any other type of disability, it usually takes longer, months and months and months. So what you can do if you're already eligible for benefits, like at 62 years old, you can file for retirement benefits and file for disability benefits at the same time. Why would you do that? Because it takes months and months and months to get your disability claim decided. And if you need money in the meantime, then at least you've got a retirement check coming in. So that is a good way to go ahead and get that started. Okay, let's see. My granddaughter is on SSI from her stepdad after age 18. If she's going to college, will she receive SSI? If she's receiving SSI, that she's not receiving that off her stepdad. SSI, you're probably talking about regular Social Security, auxiliary child benefits. The stepfather is receiving child benefits from the stepfather, who is receiving retirement or disability benefits. That's not SSI. SSI is a different animal. But the benefits she is receiving, it will not go to college. They used to go to continue to college, but it's another thing they did to stop, to save money. So now her benefits will stop automatically at 18 unless she's still in high school. And if she's still in high school, it will continue until she graduates high school, or 19 and 2 months. So, all right. Let's see. I'm unable to find a Medicaid doctor. Yeah, that is unfortunately par for the course. A lot of people are having problems finding a Medicaid doctor, and the ones they find, sometimes they are, let's say, not the best. So you definitely need to reach out to your politicians, and problem with that is it's just your single voice. But we're coming up with a program to try to help with that. There's strength in numbers. Remember, you can also appeal to your insurance for medication denials. Yes, that is a fact. A lot of people don't recognize that. If the particular medicine you want is not in their formulary, appeal. If the medicine you want is at a higher tier, because there's different tiers, tier 1, tier 2, tier 3, and the higher you go up, the more it costs. And if for some reason yours is at a higher tier, you can request a retiering and say, hey, I really need this, but it costs this much. Is there any way you can bring that down, an exception for me type thing? So, yes, you can definitely do that. A lot of people don't realize. People don't believe me. Both my PCP and gastroenterologist and neurologist, plus a social worker, I couldn't believe my Social Security office called me in a few days approved. Yes. Yep. So that is good news and terrible news. It's a kind of a bittersweet type thing. You were approved super, super quickly. That's great. The Social Security Administration did their job. The DDS, the Disability Determination Service, the one that does the medical determination, everybody did their job. So great, perfect. But on the other side, that means your disability is really, really bad. So sorry to hear that part, but I'm glad to hear that they took care of you. So. One of my neighbors who was on Medicaid moved to Tennessee and had a very difficult time finding a dentist. Yeah. If so, everybody might have a difficult time finding a dentist in the future, because that might want to be one of the, the add-on benefits that states decide, oh, we don't have the money coming in, so no more dental, which has always been crazy to people in our community here, is, how healthy you are in retirement if you can't see, hear, or eat. And Medicare doesn't cover dental, vision, and hearing, so it makes no sense whatsoever. So but we're gonna do something about that. Thank you for your good work. I was approved for SSI and SSDI in June. Sadly, I got a 0-month benefit and denied for Medicaid. Oh, the 0 monthly benefits. So, okay, well, you're denied for Medicaid because possibly your benefits were too much from Social Security or SSDI. So, but it sounds like you got approved, so that's one good thing. That is a huge benefit I'm losing in October, my extra OTC food benefit card. Yeah, I think that's because the Medicare Advantage plans, if you have Medicare and Medicaid, then you can get a Medicare Advantage plan. It's called a dual eligible plan, DSNP, dual special needs plan. And those are the plans, particularly this year, that have those grocery cards, $50, $100, $200, $300. But I think a lot of these companies, because it all trickles down. If the federal government says, hey, we're going to cut $100 billion a year, and only 5% of those lazy gamers, so 95 billion is going to be cut from state budgets, and states have already raised their hand and said, hey, we can't, we can't cover that loss. We don't have the money to cover that loss. Some states are going to say, well, I guess we have to raise taxes. So, we're going to, the crazy thing is, we pay for it eventually anyway. So the people that don't get Medicaid, that just don't get health insurance, we pay for it anyway. They just wait and wait and wait. They've got something that they can go, to a doctor and get taken care of relatively quickly and cheaply. But they don't have a doctor to go to. So they just wait, and it gets worse and worse and worse, and they go to emergency room. So what should have costs, $100 now costs us $1,000 because they don't have the money to pay the hospital. The hospital takes it on the chin, and well, they don't take it on the chin. They pass it on to everybody else. If you have regular health insurance, you have Medicare, whatever, then you're going to pay for it. So yeah, we've chosen the dumbest way to pay for it. Yeah, I need glasses and can't get help either. Yeah, it depends what state you're in. If you have Medicaid, reach out to them and, tell them, says, hey, I drive, I need glasses to drive, or I'm getting in an accident. If you have a Medicare Advantage plan, see what you can do there. Yeah, so definitely. Why is this all so messed up? This is really sad for our seniors. Yes, it is 100%, but it's a beautiful thing. According to the politicians, all this is a beautiful, beautiful thing. It's one big, beautiful thing. So, according to our politicians, and people tell me all the time, Ed, stop calling it the one big, beautiful bill. It's not beautiful. No, I'm going to make them own this. They decided to call this beautiful, and I'm going to keep repeating that our politicians believe this is a beautiful thing. So I'm 71 on regular Medicare. I went in for my routine blood test and was asked to sign a waiver to pay for a portion of it. I was very upset and didn't sign the waiver. Regular Medicare. So do you have regular Medicare and a Medicare supplement plan? Yeah, I'm not sure what the legal, some doctors, they have you sign those, and it's like, hey, we'll take care of you today, and then we'll bill the, whatever health insurance you have. But if they don't pay for it for whatever reason, they deny it, then we're going to come after you type thing. So I don't know about what exactly they had you sign. Got my disability started. Unfortunately, I have to wait 2 years to get health care. At the time, I would be calling chapter for help. Sure. Perfect. Yes. So it's good that you know. It's amazing how many people, when they're approved for disability benefits, they don't realize that they get Medicare after 2 years. And some people, if you've been waiting a year or two to get your disability approved, and they just approved it, that's what they approved it retroactively, then that time counts as your 2 years. So if they just approved it, last month, effective last month, then yeah, you have to wait the 24 months. But if they just approved it last month and they said they gave you a year of back pay, that year is part of your year waiting period. So don't forget that. George, lost my Medicaid as soon as I turned 65, lost my DSNP food allowance, had to call my state senator to get my local services office to start working on my application. Okay, good. You did not take it lightly. You did not go gently into that good night. I like it, George. Always fight for this stuff, but you're one voice, so we're gonna join together here once we get this project started. Always fight. I'm not sure why you lost it at 65. Being at 65 is not necessarily when you turn 65, you get Medicare, and if you're still low income, still low resource, Medicaid, just might pay the $185. Not just turning 65 doesn't necessarily cut you off Medicaid unless you started your Social Security benefits at that time and it kicked you off there. But yeah, it's a good thing you fought it. Tell us how that went and give us some inside scoop on your particular state. And those are the exact stories that we're going to need going forward with our new project. Particular tips, tricks, and secrets on each state, and the political leaders that are going to listen. So we're going to need your help here very soon. So even if you fill out all your paperwork and fax it in, mail it in, if you are unable to make it in person, interview will cut you off. Washington State. Yes, there's other states like that. They say that's another way they, put up those barriers, is they say, yeah, you can't do it this way. You have to do it this way. And, 100 miles from that particular office. And they just make it difficult. They say, oh, no, we don't deny people for Medicaid if they jump through all of these hurdles and do this and fill out the perfect paperwork 100% perfectly. And then we understaff those Medicaid offices to process your paperwork. And because they're so understaffed, oops, they lost your paperwork 4 times and you just give up. That's exactly, Rambo First Blood. They win by attrition, but we're not going to let them do that. Lady Rochelle, Affordable Care Act. Director, I'm so grateful for you for giving us daily updates regarding all things Social Security and Medicare. For those of us that have ACA, where can we get daily updates? That's one of the things we're going to add is the Affordable Care Act, because people, I've already joined up with Health Sherpa. So if you need help finding a Affordable Care Act, just go into my description and you'll see the link for Health Sherpa there and the phone number. And we are going to be adding that to our new project, because people that do get off Medicaid, get kicked off of Medicaid, and they've done everything and it just doesn't work, then they're going to need some type of other health insurance. And the Affordable Care Act, marketplace insurance, is essentially the only thing out there. So I saw a video yesterday of Governor Huckabee going bananas because she's just figuring this out now. Yes, a lot of these people that voted for this are like, oh my gosh, I was just towing the company line and didn't realize it went into the sea. Apparently those things are happening to people right here in the chat. Yes, that is a fact. It's already taken. I mean, the system is, the American healthcare system has never been great. The American healthcare system is one of the best in the world if you have money. If you have money, you can do all kinds of great, awesome stuff and treatments, and amazing, the healthcare system in America, if you got the money. If you don't, yeah, it ain't that great. Unfortunately, you just don't have access. And now access has always been tough, and particularly in some of these states, Alabama and Texas and Utah, and but it's going to get far, 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 far worse. Force people into homelessness. Damn. Yes. Yeah. Hopefully that. But yeah, those what is going to happen to those people that are kicked out of those nursing homes? And her nursing homes are already going under. They're saying, hey, we just can't keep sustaining this. And some nursing homes are taking that preemptive strike and they're saying, hey, there's going to be a lot of nursing home in our area that are just barely surviving now. And they're going to start, how to put this? Sorry, old Marine Corps Sergeant here. We're going to have to start unloading our patients. That's what they're saying. We've got this, and we need those beds, those Medicaid patients. We've always just been borderline with those patients, with those residents, and now we're going to take a bigger hit next year or the year after, and other nursing homes in our area are going to be in the same dire straits. So we need to do a preemptive strike and start kicking those people out now, so we can get people that have better, health coverage or have money that come in. So, and people say, well, there's a provision in the big one beautiful bill, the $50 billion slush fund. Notice that was added at the last minute. Yeah, they didn't want to add it, but they added it at the last minute. Yeah, $50 billion ain't going to cover it, considering all the places. And if you've been watching politics anytime in the last 50 years, where a lot of that money is going to go to. Yeah. I think there will be a lot of parents' action if they can live with their adult children who likely don't want them to live with them. Not at all. Yes, I think this is why this stuff was started to begin with. That's why Social Security was started in 1935, is during the Great Depression. Prior to that, agrarian lifestyle and Americans, extended families living together, but people moved to the cities and yada, yada, yada. And then, you're able to take care of your parents. And, that's in the old days. When you were young, your parents took care of you. And when you got old, you took care of your parents. But then the Great Depression hit, and the adults, the kids, couldn't barely take care of themselves and their own kids. And the parents, do what parents do. They sacrifice and they say, oh, don't worry about me. And just go ahead. Yeah, you're barely surviving. Go ahead and, take care of you and your kids. Don't worry, I'll be all right. And then, yeah, being all right is, we know the tragic stories of, parents, biting the bullet and saying, we'll be all right. They weren't all right. So that's where Social Security started. And that's where Medicare started in 1965, and Medicaid started, and all the rest of it. That safety net. But we're slowly deciding as a country that, yeah, no, we don't want that. So everybody, pull them up beside their own bootstraps. And that was always a joke. It's impossible to pull yourself up by your bootstraps. That was always a joke. Yeah, try pulling yourself up by your bootstraps. That was always a joke, but people actually, yeah. Anyway. Hello, Dr. Ed. Medicare quoted me a supplement plan for $150 a month at 60 years old. I thought that sounded reasonable. Curious to what it would cost at 65. Any ideas? So a supplement plan at 60. So you are receiving disability benefits. And wow, so you are in $150, and you might be in a particular state that allows that. You're lucky. In most states, if you're under 65 and have Medicare, the companies know that you're on disability, and they're like, wow, you're going to cost us a lot of money, so we don't want to give you a supplement plan. So in a lot of states, you can't even get a Medicare supplement plan, but you're able to do it. So $150, that sounds like it's a G, possibly. That doesn't sound bad. I mean, and the fact that you're able to get one at 60 is pretty amazing. So, but in terms of, I don't know what state you are or anything like that, but you can reach out to Chapter and they can double check and see if that's the best one for you. So, but yeah, $150 at 60 years old doesn't sound too bad at all. Usually, across the board nationally, like a Plan N is on average this year is about $80. A Plan G is about $120. So 150 is not too terribly outside of, that. Mark, reaching for retirement age on August 31st, temporarily going back to work for 6 weeks, starting 9/1. retired and have not worked since 11. I know I have to report to Social Security that I'm working. Where do I report? No, you do not have to report anything. You are past your full retirement age. Social Security doesn't care. You can make $1 billion a month and continue working, and because you're your full retirement age, Social Security doesn't care. If remember, you continue working after your full retirement age. Once you do your taxes next year, or once the IRS, your employer, notified Social Security, if this is one of your high years, then that could conceivably raise your monthly benefit amount. So that's a beautiful thing, and that's 100% automatic. You don't have to do anything. All right, I've got some video questions here. Let me see if technically this is a one-man operation, so that's why every now and then you see some crazy technical issues. So let's see. Let's go with this one first. Some people sent in some video questions.
Bad marriage, an abusive marriage, and lots of things were done. But when I went to draw Social Security, I thought maybe Mike could draw under his name since we were married for 13 years. But they said, oh, honey, they came back and said, oh, honey, you made more money than he did. And I thought that odd because when I was married to him for 13 years, I wasn't even allowed to work. He was a very controlling man, and so I didn't have a long work history. So I just thought that odd, and maybe I should have checked into it further or something. I saw your program the other night about things that we should probably ask more about. So that's what I'm doing. I'm wanting to see if I need to do something. Maybe get more help or something.
Okay. So it's Social Security determines the benefit amount by the high 35 years of earnings. So that, 13 years that you didn't work. Wow, sorry to hear about that. That is part of it, but Social Security said that the reason you're not eligible for benefits is because your benefit amount has to be less than half of that person's benefit amount while that person is still out there alive and kicking. So it sounds like that is not the fact. So those other years outside, you worked more than that person, or that person just didn't work that much, even when they worked. And people that are abusive like that usually don't work well with others. So they probably, anyway, so I won't go into that commentary. But I would double check just to be on the safe side. I would just call them up one more time and say, hey, I just want to double check and make sure, the first person told me the correct benefit amount or whatever, or they won't give the exact benefit amount. They'll just tell you whether your benefit amount is less than half, whether you're eligible for any more benefits. And remember, that's while that person is still out there somewhere. You're eligible for up to 50%. But if something happens to that person, and it sounds like you just might, anyway, if something happens to that person, then you're eligible for up to 100%. So just because you're not eligible for benefits now on his record doesn't mean you might not be eligible in the future. So if you happen to know about whether he is on this earth or not, then if you're made aware that he passes, then call Social Security and then check at that time. Or better yet, it might be easier to just, when you call and say, hey, if anything should happen to him, as of right now, does it look like I might be able to get some surviving divorce spouse benefits? And they'll tell you. That could also change in the future too, if he continues to work and make more and all the rest of it. So, yes, I would call and double check just to make sure. Got another individual that gave his date of birth, so I'm going to jump forward a little bit.
I have been a part of Medicare since 2024, but since I'm still working full-time, I am paying the $185 monthly automatically from my Wells Fargo checking account. My FRA date is on November 2025, and I would like to inquire about my CMS payment, which I am currently making through my bank. Could you please guide me on how to instruct CMS to continue the automatic payment monthly on my checking account? I understand that by the time I receive my SSA benefit, the CMS will deduct a one-time 3-month amount on my SSA benefits. Also, I have an online login, and on the retirement calculator, I can see the amount I will receive as my SSA benefit at my FRA. Could you please clarify the amount displayed on SSA website, if that is an actual or estimate?
Okay, so in terms of billing for Medicare, you are not currently receiving Social Security benefits, so you have to pay it yourself. So you're paying it from a monthly, or you can do it from a quarterly, or whatever the case may be. Once you start, it doesn't matter when you turn your full retirement age, everything will stay the same unless you file for the monthly benefits. If you file for the cash benefits, once you file for then they will just start taking the benefits out of your Social Security check automatically. And then what happens is there's usually a double payment where they start taking your benefits out of your Social Security check, but they already took it out of your, Wells Fargo bank account for that same month. And don't worry about it. The computer system will catch that and they'll give you a credit. So they won't necessarily do that 3-month thing. That's the 3 months. You haven't chosen the 3-month thing. You just chose the monthly thing. So it shouldn't be an issue once you start your benefits. So, but I wouldn't. Some people say, well, I don't want the benefit to be withheld twice, so I will just stop my payment. I wouldn't suggest that, because if you don't pay it for a month, then nasty things can happen. Just bite the bullet, unfortunately, and hopefully they catch it quickly and credit it back. But I wouldn't manually go in there and stop the payment, because every time I've seen someone do that, it's messed stuff up. So, and in terms of my Social Security and whether it's accurate, for you, yeah, it's probably going to be pretty accurate. If you've gone in there and checked your earnings record and make sure all the earnings you worked throughout your life are actually in there correctly, then it's pretty accurate. And why do I say, someone I never met before, why do I say it's pretty accurate for you? Because you're close to your full retirement age. So the closer you get to full retirement age, the more accurate it is. It's probably not exactly to the, the penny, the, $1 or $2 or $3 off or something. But the closer you get to full retirement age, the more accurate it is, because it projects in the future. It estimates future earnings. So if you're 50, if you were 50 years old and you asked me that, and I said, it's an estimate, because it's projecting forward for the next 17 years. But in your case, it's not really projecting forward very much. So that's pretty accurate. Let me see. I've got a young lady that left 2 questions, and she's shy, so she's got 2 videos here. Let's see what she says.
Good afternoon, Dr. Ed. This is my second question for today. I forgot to ask it earlier. I'm not camera ready, so I won't be showing myself.
I'm never camera ready.
I was married for 12 years, have been divorced from that husband for 20. We both received Social Security retirement. Would his benefit have to be more than my benefit in order for my amount to be recalculated to perhaps be of any kind of a benefit to me? I don't think his benefit is better than mine, but the question is, should I even bother to try, since I don't believe his benefit might not even be what mine is?
Always, 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 always try. It never hurts, because, if nothing else, then you've got peace of mind that you did everything right and you can go on with your life. That's what, half of the people, that, I'm not sure what the percentages are, but the people that watch this channel and check to make sure their earnings and make sure they're getting the right benefits, and they filed for this and they're getting everything they're eligible for and they paid for, a lot of those people, they're good. But now they know that all the stuff that they see on the internet and social media and stuff that they're worried about, no, I've already checked. I'm good. So they can sleep better at night that they've checked all those boxes. And then people continue to watch, because it's not only about them, it's about all those people around them. So that's why we've got such an awesome community here that continues to watch and get new information and passes that on to people around them and goes out there and makes sure other people receive those. Okay. So in terms of your benefits, I would ask, but if his benefit amount has to be twice your full benefit amount. Remember, as I just said, while that person is alive. So if something happens, if your benefit amount is not less than half of his, then you're not getting anything while he's still out there. If something happens to him, then if his benefit is $1 more than yours, then you just might be eligible for benefits on his record. So, and here's the first question she asked.
Good morning, Dr. Ed. We thank you again for all the help that you're able to give to us. I am a Social Security retirement recipient. I still earn income. I have my employer to withhold a set additional amount for federal taxes. Does it matter the source of the federal taxes that we're paying? Meaning that I don't have taxes withheld from my Social Security benefit, but I'm trying to make sure instead of having federal taxes paid out of Social Security and the employer, I just upped the amount that I pay, that's withdrawn from my employee withholding.
Okay. Yeah, as everybody knows, I never worked for the IRS, so I try to avoid tax type stuff. But in this is pretty simple. Yeah, the IRS doesn't care where you pay taxes from, whether you write them a check, or you take it out of your Social Security benefits. They just add all that up. So, but I would reach out to your tax professional on that just to double check. And remember, so you can have. Even if you don't have to pay taxes from your Social Security benefits, some people get taxes taken out of the Social Security benefits because they get, other income other places, and it's easier to take it out of, Social Security. It's a W-4V, voluntary withholding, and you can pick 7, 12, 22% and get that. And you just tweak it. So if you're getting taxes taken out of your Social Security benefits, and it turns out you paid too much or not enough or whatever next year, then just adjust it. If you were doing 15, change it to 22. If you're doing 22, change it to 15 or 7 or whatever the case may be. That's what people do. They always ask me the first year, how much should I get out of tax? Talk to your accountant and give a ballpark and pick it, and then check next year and then adjust it, and then you go on with your life. So if you remarry before 60, you will lose eligibility for survivor benefits. Yes. If you remarry and are still married. Yes. So some people think, oh, I got remarried before 60, so therefore I cannot receive survivor benefits on a previous deceased spouse. No. If you're 60 and still married, then correct. But if you remarried at 60, before 60, and then got divorced at 65, then you can jump over and go to that first spouse. That might be some more money on there. A lot of people are missing that stuff. So it's all just too crazy. Do not go gentle into that good night. Yes. Once more into the breach, we're good, sir. I'm tired from contacting my senators and Congress members, plus making changes due to all this madness, and I feel a lot of grief. Yes. It's hard to do it in individual, but all politics are local, and yes. So, all right, let's see. We're getting close to the end here. Let's see if I can find someone I've never seen before. Music rocks. I don't think I could even leave country. You have to have a nice bank account that I don't ever have a bank account. Oh, a lot of people, that's one of the things a lot of people doing is becoming expats. And on my website, because of that, I have a whole section on, again, mygovexpert.com. You go in there, and I've got a section on living overseas with Social Security benefits. If you're a U.S. citizen, you can live anywhere in the world and continue to collect Social Security retirement, surviving spouse benefits, disability benefits, Social Security disability insurance, not SSI. You can go anywhere except for North Korea and Cuba. Let's see. Does the insurance company for my Medicare supplement charge the same amount for everybody? If you get a Plan G is a Plan G is a Plan G in almost every state. In terms of pricing, there's kind of 3 different pricing methods. It's like when you did it, and community pricing and attained age pricing. So there's 3 different pricing methods that insurance companies use. So possibly but it's hard to tell. And then it's also based on, when you signed up. Did you sign up during your initial enrollment period, during the special enrollment period, and all the rest of it? So, Lover of the Truth. Yeah, we like that name. I am starting Medicare on September. I have both Medicare and Medicaid. Do I have to sign up for Part C plan? Or I keep my Medicaid to pay doctors and will Medicaid still pay the 185? Hopefully they'll still pay the 185, but you can just have Medicare and Medicaid. But a lot of people, they do get a Medicare Advantage plan because sometimes it depends on your particular area. It might have one of those grocery cards. So if nothing else, it's a good idea to check to see if it's, you can reach out to chapter or whoever and say, hey, and starting in September, I'm going to have Medicare and Medicaid. Is a Medicare Advantage plan good for me? So it might be good for you. And remember, you can drop those in, at the end of the year. You don't have to renew. So all Medicare Advantage plans and Part D plans and prescription drug plans are only good for 1 year. Nobody has had the same plan for 2 years. Everybody, Medicare Advantage plan, your plan started January 1st. The plan you had last year, it might be the same card and the same doctor and the same company and yada, 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 but it's a different plan. The actual plan details are different. How much you pay for the doctor, how much you pay for the hospital. The companies change that on a yearly basis, and they are going to notify you in September. It's September already. Wow. By the end of September, if you have a Medicare Advantage or Part D plan, you're going to receive what's called an ANOC, an annual notice of change, and it'll tell you all the changes for 2026. And there's going to be a bunch of changes. If you got a PPO with one of the largest out there, you just might get canceled. Not you, but your plan. They're canceling about 600,000 PPO plans, and other companies are following suit because it's all about the money, and they make more money putting you in HMO. So you really need to watch the mail. If you don't get that annual notice change by the end of September, you need to reach out to whoever signed you up and say, hey, reach out to the company, reach out to chapter, reach out to someone and say, hey, I want to check, I've got the card. I might want to just keep the same company. And if it's, it's begin for me, so I like it. I'd like to keep the same company, but I don't want everything underneath to change. What have they changed for 2026? And then you look at it and says, oh gosh, that's a deal breaker. I can't have that. So let's see if there's anything else in my area that's better for me. And then they will check out, see if there's anything better for you in your area. And then you just switch. You can only switch between October 15th and December 7th. You have until December 7th to pull the trigger. And then your new plan will start January 1st. All right, it is over an hour, and I think we went through the entire 10. So on the comments, please, if you've got any nightmare scenarios in your particular state that for Medicaid that, they do this and it's a nightmare to do this and there's no local staffing to help you out and answer questions, any of those, make sure you put it in the comments there, and we're going to consolidate all those, and we're going to come up with a plan of attack to help as many people as we possibly can, because that's what our community does, because y'all are awesome like that. All right, y'all take care. Have a beautiful night, and please, 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 please take care of each other.